Hi, Christina, and welcome to Focus 2 of Community Pharmacy Management. I apologize that these lectures are being posted a little bit later, um, but the remaining next couple of weeks, they'll be posted on Saturdays as usual. So, we're going to start talking about the overview of business planning for pharmacy programs. And before we start, too, we're also going to kind of give an introduction of what we're going to focus on Focus 2 as we're coming out of Focus One, where we talked a lot about strategic planning, operation management, HR, job descriptions, um, developing, a portfolio proposal for an employee. We're This second part of community pharmacy management is going to be heavily focusing on using financial and different types of analysis to evaluate your current business or to be able to evaluate a proposed business that you want to either start yourself or incorporate within your own company. So the overview of this intro lecture, and I provided you to please read chapter 5 of the pharmacy management book, is and the following. We're going to talk about understanding the key components for strategic planning of a business plan, understand some key measures, understand the things that, as you were focusing on your immunization program, the things that you have to look at from a financial planning, a financial analysis of your service. And as we all know, and you've probably learned in prior, courses and lectures, that without a plan, you can never reach your goal. And that's why it's so important. What we're really going to focus on in the Focus 2 part of our community pharmacy management is financial management. Today, there will be another lecture and a third lecture to help go over the brief assignment you're going to have. Is I'm going to talk to you from my perspective as um, uh, being a pharmacy owner and also helping independent pharmacies run the things that we look at when we look at a profit loss statement and a balance sheet. And I know that you should have had that experience of being able to understand those. So we're going to highlight them and talk about that because the biggest project that you'll have for the second focus, and you can use your current idea of your immunization program, or you can create another program, is that you are going to create a business program or clinical service, and you're going to develop a financial business plan projection. I'm not going to make you write a full business plan. I've done that in the past, but due to the nature of this, the way the management course is this year and time constraints, we're going to focus on being able to justify the financial. Because strategic planning is very similar to business planning, where you're outlining what you want to do. But what the business plan really is writing out the who, what's, and where's of what you've looked at in your strategic plan. And you've already addressed some of that in your immunization program. So if you continue with that program, you could build on it and we'll look at the financials. We're going to talk about some other key things. Somebody in community pharmacy, especially if you're into moving up into to management, needs to know is how to do third party payer contracting analysis. And we're going to be talking about differential analysis in the next week. And this plays a big role in determining, do I take this third party contract? Do I reject it? Do I walk away from it? Do I hope that something better comes along? We're also going to do a lecture on target marketing for financial projection. And I'll briefly mention the importance of that in this lecture. But to be able to do financial projections, you've got to go to do a good target marketing analysis. We'll also talk about another key component in pharmacy, community pharmacies, the accounting for inventory and cost of goods. We'll do a lecture on break even analysis, cash flow analysis, and budgeting. And we'll also wrap up at the end of this focus to talking about pharmacoeconomics. In your financial business plan, and I will be going over that with you when we have our Zoom meeting, and I'll post next weekend your final project outline, you're going to be doing a financial projection of your clinical service or program. In that, you'll do a target marketing analysis, you'll do a budget, and if there's anything else that you want to include in that to justify your return on investment. And we're going to talk briefly about return on investment today, and we'll talk about that even more in the coming weeks. So let's begin. What's the purpose of a business plan? The purpose of the business plan is to provide data and proposed actions that are necessary to answer the question: should we invest in this new proposed business or clinical service or program? The business plan also helps us look at the future risks and benefits of the proposed new program. And as with strategic planning, the business planning produces a written plan. But when you're writing this business plan, you're going to be writing it to the audience that you hope to seek approval. That could be either your director, a boss, a partner that you want to partner with, such as maybe a healthcare provider. It also, if this is your own business that you're starting as an entrepreneur, this is something you may need to propose to investors or to the bank itself. One thing when we're developing a business plan is we're looking at to make sure we optimize pharmacy's value equation. We're looking at whether or not this is going to be able to be sustainable and worthwhile to do. So if you have an idea for a program or a service that you want to add to your current business, you have to look at things of how does it satisfy employees and providers? What are the goals to make this successful? What are some clinical, or regulatory compliances we have to do to make this successful? How is this going to be worked efficiently? So we're making sure the medication use process, and this is part of a medication service, that providing safety to the patients and protecting our employees. We have to do good financial productions for budgeting and forecasting. We have to have some operational out there uh, written down. We need to identify who need to be leaders, what type of roles of positions we need, whether it's pharmacists or technicians. And so optimizing the pharmacy value equation is key in developing that business plan. The key steps in development of a business plan is we need to define the business or the program. And I'm going to keep reflecting back to your immunization strategic plan that you present. You would define why this is important. What is the purpose of this? And most of the time, when you define the program, you're going to justify it by doing a good literature analysis of what has been done out there, whether it's in, bench research of some type of clinical service or some type of entity. You want to be able to show, why is this important? Why do we need to be doing this? In addition to justify this new program or business, you need to conduct successful market research and analysis. You need to identify who is your target market. Who is that? Sometimes it's the patient and customer. Sometimes it's the provider. Sometimes it's the payers you're partnering with. And it could be a combination of all three. You need to, as you did in your prior strategic plan, look at your competitors' analysis. You may need to do a SWOT analysis. And you also need to assess what are the clinical and quality requirements to make this program successful. Once we conduct that, we also have to be able to outline in our business plan the processes and operations to make this work. What is the workflow of this? Because this is also going to play a big role in our financial projections, because we need to know how much manpower we're going to need. What are the hours of operation to get this done? How many days a week or how many times a month does this program or service exist? We need to develop a market strategy. How do we get people to find out why we have this? Whether it's dealing with a healthcare provider, patients, healthcare entities, or payers. And the most important part is we got to make sure can this financially stand on its own over time. All projects and programs may need time to develop, but do we have enough financial resources so that we're not, going thin on those to make sure that once this program becomes profitable, it can stand on its own? We need to come up with a timeline, to hold ourselves accountable of when we're going to get this done. And I think one that, besides the SWOT analysis that a lot of times people don't do in planning is, what do we do if this plan fails? What happens? What happens if we create a new job and this service goes away? Do we just let that employee go, or is there opportunities to absorb these people into other parts of our company to make this successful? When you're writing a business plan, there are always key components. There's that executive summary. That's that wow statement that when you are writing this to the audience who you seek to get approval for this, you need to be able to write, you know, that overview of everything that's in that business plan. It's just like the first couple minutes of a movie or the beginning of a chapter of a book. You need to capture that person in so they go, I want to see more. Obviously, the business plan, you need a table of contents to tell the who, what's, and where's of where to go. That background that I said earlier, you need to be able to justify through literature research of why this is important, giving them statistics, financial, analysis that have occurred. Then you need to outline the full proposal of the service, how this is going to be done, the who, what, and where's, the operational part of it. Then you need to put together with your financial implications, what are the resource requirements to make this financially successful? So you may need to provide a budget. You need to do financial projections, and you need to show what is the return on investment, the benefits of this proposal. As I said at the prior slide, you need to have the milestones and schedules of when this is going to occur, and a summary and any supporting documents or references necessary for that business plan to be successful. We talked about this in strategic planning. We need to identify our customers. All business plans should have a good mission and vision statement, even if it's an add on to the current company's mission and vision statement. We need to think about the strength, weaknesses, opportunities, and threats, and how are we going to overcome those threats and weaknesses. We need to establish good goals, and we need to define metrics to identify accountability. And as we develop those objectives, we need to make them smart objectives. We need to be specific exactly what do we want to achieve and how we're going to measure it, when we're going to measure it, and how is this relevant to our core value of our company, and how does this bring value to the partners that we work with, patients, providers, payers. What are some barriers to effective planning and business planning? It takes time. As I mentioned before, often in pharmacy, we are reactory. We know how to handle in a crisis because in community pharmacy, we've traditionally always been when you open up the doors, you never know what you're going to get. But good planning takes time. There also may be some interpersonal issues and struggles of people who might be resistant to this or don't see your same vision. And how can we persuade those people? So this takes even more planning and also prior meetings. There's no sense in writing a full business plan if you don't have some initial buy-in. Maybe you don't have enough planning skills, and this takes time. And the other thing is failure to give yourself enough time to plan into the future because things are constantly changing. Sometimes we got to do a business plan pretty quick as we reflect back on this entire year when we had to do changes on how we operate due to the COVID crisis. As we rolled out this vaccine initiative over the last couple months, we had some time for planning, but probably we weren't able to do a 3 to 5 year plan on this. The other barrier is that we don't monitor our progress. We may be going the wrong way and we just keep going because we're supposed to be going and we don't stop to look at that. The other thing is, as I said before you start this, you want to make sure you talk to those who you're going to want to get approval for this, is at least giving them your pitch of why this is important. I think a key thing that's important is, if you're going to be a leader and wanting to be able to move the needle in this profession, you have to stay up on this profession. And one of the things, and I shared, I might have shared these slides prior to you before, but I have my clinical resources that I use to keep me up to date from a clinical perspective. But I also use things such as Twitter lists. I follow different organizations, not just pharmacy, but medical, what's going on from providers and payers. And I try to keep up to date with those at least once a week. So I keep my, finger on the pulse of what's going on in healthcare, because the great Wayne Gretzky always said, you don't skate to where the puck is, you skate to where you know where it's going to be in the future. And we have to always be looking at that. So I use two different things, and this is just me. I created years ago. I don't tweet. So if you follow me on Twitter, it'll be rather boring, but I use Twitter as one of my news aggregates. And what I do is I collect Twitter list groups, pharmacy organizations, medical organizations, health plans, and I put those together. I also use another app. It's called Nuzzle, and Nuzzle actually will pull from these lists key articles that were posted recently, and I'll look at them and then I'll save them to various different places on my computer. Maybe I don't need them now, but I may need them for future research in the future. So where to start in terms of business planning? Well, the best way to first start a business plan is start with an example business case that was approved by your organizations. Ask a colleague for a template. When I used to do research when I was full-time faculty, that's how I did a template when I first did research. And I look at research proposals, like writing a grant, and a business plan very similar. One of the things you always want to do is write a one-page proposal paper, um, kind of outlining all the key things that's in a business plan. That might be something you share with colleagues or your boss and say, hey, I've been thinking about this. What do you think about this? Could you read it? Let me know before you go into writing a full thing. And as I said, discuss with your boss before you share it with them. Most bosses hate surprises. How many pages should you expect it to be? A good business plan is going to be probably about 20 or 30 pages. And that is why, for the sake of time and focus too, I'm not going to have you write a full business plan the remaining of this semester. But you already did the strategic planning part. And so a business plan is not much different by adding that in. And so that's why, as we do the financial management part for your final project, this is going to you're going to get a feel for what all you would have put into a business plan. There's lots of different organizations. Pennsylvania Pharmacy Association actually has a website committed to helping um, people who want to develop different types of clinical services, and they actually have, a reference of the key components to a business plan. Has some other helpful hints. You get a first draft ready and plenty of time to run it by 3 or 5 people for feedback. Develop frequently asked questions, talking points for your boss. Build in assumptions for growth. Um, so what will happen, and this is why you do financial projections. So for example, what if I develop an anticoagulation clinic and the enrollment is greater than 300 patients? When will I need to add additional staff? And that is why doing financial projections and is key. The other thing is, when you're writing this business plan or you have this idea, know your organizational strategic plan. And does this follow along with it? Know who has your back, who's going to support you, and give credit where credit is due when you're writing that. Another thing to make a successful business plan within an organization is that internal rate of return. And what is that? It's the discount rate often used in the capital budgeting that makes the net present value of all cash flows from a particular project equal to zero. The higher the project's internal rate of return, the more desirable it is to undertake the project. So, what additional capital resources do you need? What current capital resources could you use? And so those all play a big role in successful of a program. When we're writing this plan, always think about who are your key stakeholders. Is it patients? Is it providers? Is it payers? Is it all three? And if it is, what's the win-win for each one? What are some barriers you might face? And how are you going to overcome this? How can I get buy-in? What are the one or two keys to your success? What will you measure to demonstrate your value? What are those SMART goals and objectives? The keys to a winning proposal is know your numbers. Publish literature and your own numbers that maybe you've done a test pilot with this. Make it personal with examples from your company. Highlight benefits to others in the system. Figures, graphs, tables can play a big role in winning this over. Help your boss advocate for you and practice what I like to say is the elevator speech. And what is an elevator speech? Well, if you were stuck in an elevator, which in the COVID days probably is something that doesn't happen often anymore, and you had only a minute or two to tell somebody, hey, what's that proposal about? Could you give them exactly what the project service is? Why is it important? What will the results will they look like? And what is needed from everybody who needs to be involved? Knowing how to present yourself, having confidence in why this program is necessary to the overall, values, goals of the company. How is it going to move the needle, grow us, be successful for our partners and for ourselves? Those you should be able to tell in your speech. So, what the project service is. I want to let you know about a new pharmacy service starting next Monday. Pharmacists will automatically assess your patient's meds and adjust doses daily for the renal function. So, this is an example if I was proposing this to a provider, a healthcare provider, or a physician. Why would they want to partner with you? Think about your immunization program. Well, how would you describe that to one of your homes that you would want to propose it to? How would you decide it to some of the execs that oversee you to be able to sell that? Why is this important? Well, for example, in our example here, the Medical Executive Committee approved this project because many patients have rapidly changing renal function, and it is often difficult for pharmacists to reach physicians to request dose changes when they're busy in the clinic or OR. Why is your program important? What would you tell somebody? What results will look like? This service should optimize drug therapy and result in fewer phone call interruptions for you. What do you hope to change with your results? What is needed from the receiver? One thing we need from you is to let us know if you have intentionally dosed more or less aggressively than recommended so we don't modify those doses. What do you need from your homes that you're dealing with? What do you need from other partners within your company for this to be successful? The other key thing in developing the business plan, especially if it's a clinical service or program, is what's called the relative value theorem. What does it cost in dollars, time, and emotional energy? And what do I get in addition to the goods or services? If the price and the service equals a perceived value, all right, You have a perceived value, then what is the relative value? People will buy into programs if they see there's a value to it. As we are slowly moving away from the distribution part of pharmacy, hopefully in community pharmacy, we need to be able to sell this to partners of why they need pharmacists to be involved in different programs. And the remaining of the next couple slides, I'm going to talk about why would other partners want to partner with us. Well, there is lots of different data out there that shows on how adherence, and we know this, and I'm going to talk briefly about Medicare star ratings of, how that certain things can help lower costs in healthcare. The two most expensive things in healthcare right now are hospitalizations, ER visits, and overutilization of non-scheduled regular checkups with physicians. This is an example of a study on looking at the impact of medication adherence on hospitalization risk and healthcare costs with diabetes medications. As you can see in this chart, even though diabetes medication costs may have gone up as we made somebody more adherent, the overall healthcare costs significantly dropped regardless of the increase in drug costs. And this is why, as we start to look at other new programs in community pharmacy or outpatient pharmacy, why payers and providers are interested in us, because we know that we can have a big impact. Now, we're going to talk about financial projections in the next lecture here, but whatever type of service we are trying to do, we always have to come back and think about where we began. Well, Pharmacy Accounting 101 in a community pharmacy is the following. You got sales. If it's a traditional pharmacy where we have inventory, you have cost of goods, and your sales minus your cost of goods equals gross margin. And so that gross margin has to be high enough so it covers our operating expense so that we have a net profit that's worthwhile to us if we're our own personal owner or we are a large corporation and we have to answer to our investors. To increase profitability traditionally in the old fashioned way is we either increase sales, and we do this either by price increases or volume. And as we know, most of our third party payer contracts are not increasing us in price. It's take it or leave it type of things. Okay. And then we also have to look at, um, you know, do we do it by volume? And that is why you see a lot of pharmacies, community pharmacies, both chain and independent, pushing volume to try to offset, the decrease in price in gross margin for sales. The other way is to buy cheaper, to be better at controlling your inventory. We'll talk about that when we talk about inventory and cost of goods later on. And finally, the other one is reducing operating expense. But in pharmacy, you can only cut so many FTEs until you affect the risk for service. That is why whatever program you're doing that might be different from this normal distribution process, you have to show, does it bring in enough sales to cover to cover your operating expenses to show a return on investment. And pharmacy services is a different type of financial management that we have to think about. And when we're business planning for new programs that are not your traditional filling prescriptions, we have to look at that. When we're looking to develop what the value is in selling these programs, we have to answer the question, does our service help solve our partners' problems? And does it make our partners feel good about partnering with us and using us? Our partners could be patients, healthcare providers, or payers. In healthcare in general, not just pharmacy, over the last 10 some years, and maybe a little bit more than that, we have gone slowly from a fee for service type of industry to a value based, quality driven. And value is the balance of quality and cost. And it can be debatable, what do we measure that is value? But we're trying to get away from this. You just show up, do your job, and we pay you, regardless of what the healthcare outcomes are. And in healthcare, we're slowly moving away from this fee for service. And both in Medicare, with the Medicare Access and Chip Reauthorization Act of 2015, which had developed the merit based incentive payment system. Since Obamacare, the Affordable Care Act in 2010, we have seen the development of advanced alternative payment models with account care organizations, patient centered medical homes. We've seen additional Medicare clinical services developed with chronic care management. And we've seen that who is allowed to do these services has also changed too. And slowly pharmacy, depending upon the state where you practice, if you belong to any pharmacy type of care networks, pharmacists are slowly being allowed to be part of these qualified healthcare professionals, especially if they collaborate or with collaborative agreements with physicians to do. And they are also able to bill for evaluation and management visits. There's a ton of measures out there, and I'm just going to briefly mention some of them. And I'm not asking you to know all of them, but all of these measurements are daunting in this healthcare new value based system. We have different measures. HEDIS measures are to evaluate commercial health plans and Medicaid plans, which then also use those measures to evaluate physicians. Medicare in the star ratings. Commercial programs have their own measurements. Account care organizations, the medical home model measures. But knowing these measures can show, and understanding these measures of what's out there for providers. When I say providers, I'm talking mainly physicians and hospitals and AM care clinics, is we can then show how can pharmacy partner with these providers to help improve these numbers. This is a chart from 2015 showing the various setting: hospital, ambulatory care, post-acute care, and all of them have different types of Medicare incentive measures. We classically are familiar with in community pharmacy that we've been dealing with over the last 10 to 12 years is the Medicare star ratings. And these were developed to evaluate Medicare managed care, Part C plans, and standalone Medicare D plans to make sure they're doing what they say. Another thing that came out from the Center of Medicare and Medicaid Services was in 2015, the Medicare Access and Chip Reauthorization Act. And this was asked by physicians to either participate in advanced alternative payment models or participate in the merit based incentive payment systems. And they had up until 2018 to voluntarily participate. And now they are solely being asked to participate since 2019. And they wanted to look at what are practices doing to improve quality for their patients, to do different activities to help improve and control costs. And so there's different things they look at. They look at quality improvement activities, promoting interoperability, which is making sure they're looking using like things like electronic health care records, and also making sure that they are controlling costs. And if they don't have these type of entities in place, they can see a decrease in their Medicare payments over time. What are some of these measures that they're being held accountable to? Things such as all their patients in their practice, where are they with their hemoglobin A1C? How are they in weight loss, immunizations, screening for high blood pressure, tobacco cessation? All of these different type of measurements, pharmacy could be involved in various different programs. Pharmacists are able to do tobacco cessation. Pharmacists are involved in diabetes education programs. Pharmacists are involved in immunization programs. Alternative payment models like account care organizations also are held to different types of measures and standards. And these can be things such as patient experience, preventive health measures. Once again, we see vaccinations and tobacco cessation, care coordination and safety. Adherence plays a role in at risk populations, making sure they're on the right medications. And traditionally, we have the Medicare Part C and D star ratings. And if these plans don't have a star rating of at least two and a half and above, and if they're less than that over 3 consecutive years, they could be asked to leave the Medicare system for that. And they also look at those various measures. We're traditionally familiar with the adherence measures, such as with diabetes, hypertension, retention drugs, cholesterol medications, and MTM completion rates. All of these things are a reason why new type of pharmacy clinical programs could play a role and could have a return on investment, not just for the providers and the patients, but also for the pharmacy company entities. Adherence is probably our cornerstone to start with. In the USA, it's estimated that only about 50% of patients continue at 6 months of their medication and 30 to 40% at 1 year. Part D plans are asked to focus on things such as high risk medications that can be used in elderly patients, diabetes treatments, adherence to diabetes medication, hypertension drugs, and cholesterol. And these are measured by, the Medicare D plans and Medicare C plans. My companies that I work with, we belong to an organization called Equipped. And Equipped actually is a company that partners with the health plans, and I actually get a grade report of what my adherence rates for all my stores are. And that is why we've been very proactive in our MedSync programs. We've been very proactive in talking to patients about adherence, because this has a big impact on us, because not only has an impact on, we're not getting paid anything more for this, but it affects our DIR rates, of which we could be penalized and money could be taken away from us and when we get paid. HEDIS measures, which are the measures that commercial plans and Medicaid plans are graded by, these are often, used to also grade the healthcare practices, the physician's office, the AmCare clinics. And if you look at some of them, they're looking at outcomes such as diabetes and hypertension, asthma care. They're looking at, opioid usage, high risk medications, all of these things us as pharmacists are trained to do and partnering. Currently, right now, my pharmacy and multiple pharmacies across the state of Pennsylvania are in a Medicaid care program right now for asthma. And we're focusing on patients' understanding of their controlled medications versus their relief medications, making sure they're adherent, making sure they understand action plans and why. Well, one asthma hospitalization could be 11 to $15,000, and they're paying us per month to evaluate these patients to take care of them. And so this is a service to do that. HEDIS measures have multiple things. So, for example, doctors are asked to make sure that patients are being screened for high cholesterol between the ages of 18 to 75, and they're being treated appropriately and reaching target goals. you know, Controlling of hypertension, controlling of blood pressure, being on anticoagulants when necessary is so important in covering the cost of stroke. Currently, stroke accounts for almost 1% of hospital admissions in the US, but it can be $43 billion per year. And so having programs that can help control things such as hospital readmissions, initial hospitalizations, rehabs due to stroke can have an overwhelming. So when you're developing a business plan and developing financial projections, it's so important for this program. You think about what are the outcomes we need to look at to measure for its success. And there's three types of outcomes we should be looking at: economic, clinical, and humanistic. How will we track these outcomes to show the quality of care we provide? What can be monitored and evaluated? What processes will we measure? What patient outcomes will we measure? Who is measuring pharmacy and other healthcare partners? Economic. Economic is the financial return on investment. Is money gained or lost based on a financial investment, cost savings on medical or pharmacy services. And so economic, we may look at, you could look at things such as, what is the number of sales and immunizations that you did for your immunization program? Or you could look at, what is the gross margin of those? But you could also look at that healthcare entity of what is the percentage of patients that, haven't got vaccinated, and you could project out to what are the percentage of patients could be, have a pneumonia or flu admission in the next year. Clinical is to look at things that, those disease specific measures, reduction in blood pressure, reduction in hemoglobin A1C. And humanistic is more patient satisfaction, physician satisfaction, quality of life type of evaluations. How economic outcomes can be the measure of return on investment, the measure of total healthcare costs um, saved for patient, employers, and health systems. It could be the measure of additional prescriptions due to your program through like adherence. Clinical outcomes can be things such as reduction in adverse redu- drug reactions, improvement in medication adherence rates, exceptions of physician recommendations, and those disease specific measures like hemoglobin A1C, blood pressures, INRs. Humanistic can be done by using satisfaction surveys to get patient, staff, perceptions, quality of life surveys, measuring sick leave, increased work productivity, all could be used. So, in developing a clinical service, it's real important that somebody understands that a clinical service or new program, when you're developing financial projections, is that it is no different than a P&L of a pharmacy looking at prescription sales, non-prescription sales, and total sales and cost of goods sold. So, if you think about it, whatever our clinical service is, it's going to hopefully bring in revenue. We're not going to maybe have product, but we're going to have operating expenses. And so you're going to have salaries. We're going to have store manager salaries, benefits, different variable expenses. And the overall goal is this: at least if we're a for profit company, there's a net profit. If we're a nonprofit company, at least we're not in the red. There's numerous different studies to look at the cost of dispensing, like what does it cost, how much labor it is to cost to dispense. NACDS and NCPA publish every couple of years what it costs to dispense for a pharmacy to stay profitable. And the average cost for dispense right now is probably around $10 to $12 per prescription. But when you're looking at planning for financial clinical service programs, you have to look at those costs. What is the salary of the service personnel? So depending upon how long does that service take to do, that's how you're going to factor in the salary service personnel. What are the materials and supplies? What are the non-direct costs or the overhead costs that would be involved in developing this service? The other important thing in evaluating the financial success of a new business program or clinical service is the return on investment. There are many different elements of return on investments. There's the cost, capital, and operating costs. There's the financial return, whether it's revenue or it's savings. There is, benefit calculations and non-financial benefits. What is return on investment analysis needed? We need to make sure that whatever we're doing is we're limiting our operating resources to make sure that we have some type of optimal financial results from our investment. So we want to make sure that what we're doing is providing positivity back, whether it's financials or it's savings. When we look at the costs and return on investment, we have capital and operating. Capital could be what we initially invest to do this service. So this could be technology, equipment, remodeling. And most of the time, capital can occur over 1 year, except sometimes we may, if we are able to depreciate some of that, whether it's computers or technology, we may depreciate that capital cost over a period of years. Our operating costs happen every years, and that is our supplies and our labor. And so when we're developing this calculating of service costs, and we're going to do an example of this, Christina, when we talk in our Zoom meeting, is how do we determine whatever we charge for a service is going to able to cover it? Well, the one first easy in pharmacy is this service we're doing, does it have to be completely done by a pharmacist, or can technicians be involved? Because the salary costs play a big role in that. And we also have to make sure whatever revenue we're bringing in, it's going to cover at least that pharmacist's time. So this is an example of calculating a service cost. And this is if I was doing a lipid screening program where I actually had a cholestic machine to get a total lipid panel, and I would actually prick the person's finger, get their blood, put it in the machine, and evaluate it. Now, if this service initially only involved a pharmacist doing this whole thing, not a technician, think about the pharmacist. If we were paying this pharmacist about $50 an hour, at about maybe $25 in their benefits of what we're also paying. So this pharmacist is actually costing us about $75 an hour. Is if each test takes about 15 minutes to perform, so that is just a quarter of an hour, then that means it's going to cost us in labor $18.75. If the cost of performing the test with the supplies and equipment is around $10 per test, then our total cost is $28.75. But here's some examples of Medicare reimbursements. Our reimbursements are $19.55, $21.66, $19.57, depending upon what type of lipid test we're doing. The average cost of the cassette is around $8 to $12. The cost of a collect machine, which would be our capital cost, is around 2,500. And then we also would have to spend in that first year to get approved for a CLIA waiver, which could be a couple other hundred. So if you think about it and you go back, our total cost that I calculated was $28.75. Based on that reimbursement, we're already losing money. So what could we do to be successful on this? Well, maybe we find out, could the pharmacist bill for their service on the evaluation of that test as a separate service? And maybe the cost of the test that we bill out for is done by a technician, where we can reduce our operating costs. So the definition of return on investment, and I'm sure you've talked about this in numerous other lectures, is a ratio that divides the net benefit of the total amount of investment. It's a straightforward financial tool that measures the economic return of a project or piece of equipment. It's the amount of bang for your buck. So it's the gain from investment minus the cost of investment over the cost of investment. And usually you times that by 100 to get a percentage. So when we look at financial return, we're looking at growth, charge capture, reimbursement capture. So we're looking at revenue. We could also look at financial return on investment in savings. How much did we save? And when we look at clinical services, like in the inpatient settings, that is what, when they use pharmacists, that's what they're looking at. So they may look at hard savings, such as drug costs, personal FTEs, reducing cost of harmful med errors, reduction in nurses, cost avoidance, slowing the drug cost trend curve, preventing inappropriate use of new drugs, adding robotic dispensing technology that will enable us to grow without adding new personnel, preventing costs of harmful medication errors. So this could also be applied to different type of things. So say I'm adding a Prada machine to do, the baggy system packaging for adherence. What would be our hard savings over time in additional accounts patients without increasing our labor. So return on investment can look. Soft savings is patient safety, improved operational efficiency, reallocation of FTEs. So those can be think of in return on investment. So here's a simple example of a profit loss statement example. So say in the first year of whatever service I'm doing, I'm only going to bring in about $30,000 in net revenue. My total cost to deliver this service, whether it's capital or labor costs, is around $50,000. And my net income then is a $20,000 loss. So next year, I grow the program even more. I get a net revenue of 60,000. I'm able to maintain my total costs at 50,000. So my net income is 10,000. So in 2 years, I'm only down now 10,000. The following year, I accrue by my financial projections. I grow revenue even more. I control my costs, and now my cumulative profit is 10,000. And this is what I'm talking about when we're going to be doing some financial projections for your strategic plan and building on that as a business plan. And once again, Christine, let me just mention again, you don't have to do the immunization. You can pick a different program we could do. But if I look over 3 years, what is my return on investment? Well, my return on investment would be, let's go back here, is my total cost was 150,000, right? All right. And my net income over those 3 years was 10,000. So my return on investment actually was still positive, it was 6.66%. So this is what we're talking about. When you're trying to get buy-in from leaders, from your boss, from managers, from other partners, things aren't going to be successful right out the gate. And you have to do these financial projections to show them that we can be successful. And so, whether it's cost savings or increase in net profit, those are the things that we're looking at. So hopefully this kind of gave you an introduction to what we're going to be doing. And then what I just want to share with you that, the additional things that I'm going to ask you to do for this week is to watch 2 old videos of mine. And the first video and the second video go hand in hand. The first video goes over financial analysis from a community pharmacy entrepreneur perspective. And I use this in my entrepreneur class. So when you listen to it, some of it's talking to my entrepreneur students, but it's still the same thing. And so please watch it. I talk about the importance of financial ratios because one of the things besides planning, like I talked about in this lecture, we have to go back and look at things. And I'm going to give you an exercise that I'd like you to do where you're going to um, do these financial ratios for this company called Healthcare USA. And I would like you to then take those and do those calculations. The other additional thing, and I'll have this posted, is I'd like you to begin to think about what things do you need to think about to show the financial success of your clinical program or business program idea. All right. I look forward to talking to you the week of March 15th. Next weekend, I will be posting the lectures on differential analysis, third party contracting, and target marketing. Take care.